there is another product, which is a 3-month interval drug, which is a Paliperidone Palmitate, extended release. How does that compare with the drug we were just talking about? And in terms of mechanism of action, bioavailability, all the boring medical stuff, the half-life.
I think it's great that now we have drugs that will last not only 1 or 2 months, but 3 months. It's not for everybody, but there are some patients who definitely having a 3-month injection would be the way to go. So I think it's...
Can you compare these two drugs in terms of mechanism of action? Are they different?
Well, I would say the main difference is that one lasts, it's very simple, 2 months, and the other would last 3 months.
It's a
and
half-life
if you
issue,
tell me
and
which
that's all?
one is better, it really depends on the patient. Some patients respond better to some drugs, some respond to other drugs.
But they are different active compounds. So one
That's what I
is
was getting at. How do they work?
active aripiprazole, which is a partial agonist, so it's more of a dopaminergic modulator, and the other is based on another agent. When you talked about the 3-month injection, which is really related to risperidone. So they're going to have different side effect profiles. They're going to have different mechanisms of action to some degree, and it's really individzed to the patient.
Yeah. Which one is better? Depends on the patient.
What about the extrapyramidal? Well, no, it's okay. You know, you're always going to say that. There's patient variability. Right. What about the extrapyramidal symptoms? Is one better than the other?
Well, again, it depends on the...
I knew you were going to say it depends.
It depends on the patient, but overall, that you may see less potential for... When we talk about extrapyramidal symptoms, we're really talking about, for the most part, dopamine-induced Parkinsonism, because that's what happens when you block dopamine. And it can be different by dose. It could be different with different patients. There's different with prolactin levels. There's a whole host of adverse events that are different between the drugs.
But this was the main difference between the first and the second generation. More EPS in the first generation. Tardive dyskinesia that we mentioned, present in both, but definitely the prevalence is higher with the first generation.
If you wanted to switch from the 2 to the 3 or the 3 to the 2, are there issues clinicians need to know about?
Well, for the 3-month, for certain, you don't start right on the 3-month. There's a preparation that's actually 1 month. And once you're stable on the 1 month, you can transition to the 3-month. The 2-month preparation that we talked about, the aripiprazole, Loroxil, you can start right on the 2-month. You can start right on the 1 month. So there's not this schedule that you have to go through.